Allergic rhinitis. It's also called hay fever. The word allergic rhinitis is derived from Greek word, which stands for rhino means nose, itis means inflammation. So allergic rhinitis is the inflammation of the nose, and it is caused by allergens. And the most common associated and identified allergens include pollen dust, animal hair, and mold spore. Nasal cavity have two chambers, which are surrounded by paranasal sinuses, and the two chambers are separated by a thin wall called nasal septum. As you know, nose has three functions. The first one is as air for resonance of sound, second one is olfactory purpose, and the third one is as a part of upper respiratory tract. It's important to inhale as well as to warm and filter the air. And the nasal cavity is lined by a mucous membrane which is rich in blood supply. Allergic rhinitis is caused by type 1 hypersensitivity reaction, which means it starts initially after exposure to environmental allergen, and which make mast cells to become sensitized. And in the subsequent allergen exposure, the mast cells will release histamine and there will be exaggerated inflammatory reaction, which causes the nasal mucosa to become inflamed and swollen. Plus, there will be increased mucus production, which leads to nasal drip. As you know from your anatomy, nasolacrimal duct opens into the nasal cavity, and it will be blocked and cause watery eye. In addition, the eustachian tube may also be blocked and become a risk factor for otitis media. Clinical features include congested and swollen nasal mucosa, watery eye, nasal drip because of increased mucus production, sneezing, and usually it is seasonal. Diagnosis. The diagnosis is usually clinical, and usually we will see the above explained risk factors and clinical features. And it is seasonal. The investigative modalities include skin prick test, patch test, but both these tests have low sensitivity and low specificity. Blood tests include total blood eosinophil count become increased, total serum IgE level will increase because of the allergic reaction, and nasal smear test can also be done. Treatment. The best and important treatment for allergic rhinitis is to avoid the allergen as much as possible. The others include intranasal corticosteroid, mast cell stabilizers, because mast cell is a major mediator for this allergic reaction, like cromolyn and nodocromolyn can be used, and immunotherapy are some of the choices. Thanks for watching. Don't forget to subscribe, comment, and share.